A patient undergoing an EKG test suddenly shows signs of distress. So suddenly shows signs of distress and elevated blood pressure. What should the medical assistant do immediately as your number one first step? And now, something to keep in mind here is that when this question is saying signs of distress, it doesn't even matter here that it's elevated blood pressure. They could be saying shortness of breath, feeling faint, anything. No matter what it is, that should always raise red flags, because anytime you have any sort of severe or serious complication from any sort of procedure as a medical assistant, you always want to stop it and keep the patient safe and do whatever you need to do to keep the patient in a safe and comfortable position. And the truth is, when you get questions like this on your exam, even though it says EKG test, you could insert anything in this case. So you might see questions where they talk about a cardiac stress test, or maybe you're doing a blood draw. It really doesn't matter. The overall idea that they're testing you for here is they want to see that you know what to do in a case where a patient is showing all of a sudden feeling distress or having some severe symptoms that they weren't previously. Questions like this is that you stop the test. Stop the test. The answer choices might vary. Sometimes they might say to stop immediately. They might stop immediately and reposition the patient. But the overall idea is that you want to stop the test when they have these severe symptoms or reactions. So if we look at the choices, option A says to stop the test. Look quickly through the other choices. Do any of the others say that? Asking the provider, continuing something, adjusting. So it's looking like option A is going to be the choice we're going through, but let's just go through all the options so we know why they would be incorrect. So option A says stop the test and notify the provider immediately. Now that looks exactly like what you should be doing. So we'll go with option A. But let's go through the other choices just to make sure we understand those two. So option B says ask the patient to relax and take deep breaths. And maybe that's something you would do after you stop the test. But the question is asking what should you do immediately. So maybe this would be your number one, and then maybe number two. You would maybe not ask the patient to relax, because if you tell someone relax, that's going to be difficult for them. But maybe your number two step would be trying to calm the patient down. If this answer choice said try and calm the patient down, try and put them at ease, that would be your second step, but not your first step. Your first step is to stop the test. So we'll eliminate option B. Option C says continue the test to complete the readings, and nope, we want to stop the test immediately. So eliminate option C. And then option D says adjust the electrodes and continue the test. Nope, we don't want to continue the test. So eliminate option D. So that leaves us with option A, stop the test and notify the provider immediately as your first immediate action.